Hello everyone, wherever you are in the world. My name is Joanne Price and I am the Chair of IOSH's Consultancy Group. I'm also a member of IOSH Council and IOSH's Merseyside Branch Committee. The Consultancy Group have been working hard behind the scenes to produce a number of webinars which will be presented over the next few months. I'd like to take this opportunity to therefore thank the Consultancy Group Committee for all their hard work, as it should be remembered that they are all volunteers. Thanks also to Julie Littlejohns, our IOSH Relationship Manager, for her continued support. As Ben has mentioned, this webinar is being recorded and along with the slides will be made available in a few days. Please share any message you may have with fellow attendees using the chat box. However, if you have a question for one of the panellists, please use the Q&A box. The Q&A box can also be used to let the committee know of any other webinars you would like us to provide. Your feedback helps the consultancy group to provide you with relevant content. A Q&A session will follow the presentation along with the short poll. So the consultancy group are pleased to provide this webinar in conjunction with Alcumus ISOQAR, and I would therefore like to hand over the reins to their Head of Marketing, Phil Barwell.
Good morning everyone. My name is Phil Barwell, Head of Marketing for Alcumus ISOQAR, and I'm joined today by our PAS 3002 experts, Amanda Mathie and Amanda Spedding. The purpose of today's webinar is to help you understand how businesses can use the structure of certification, and in particular PAS 3002, to help support the health, safety and well-being of employees during these difficult and unprecedented times. In addition to PAS 3002, we will also be providing you with a brief introduction to ISO 45001, the management system for occupational health and safety. Together, these combine to create a comprehensive health and safety and well-being system for any size organisation. For those not familiar with Alcumus, we are a risk management business focused on the health, safety, environmental and quality disciplines. In our business, we talk about helping organisations to become safer, healthier and stronger. We do this through a variety of products and services to help organisations manage their risks in relation to people, properties, hazardous substances and the supply chain. Alcumus ISOQAR, the certification division, is UCAS accredited, and we have been auditing, certifying and training businesses across the UK and globally for over 25 years. To confirm, these will be the topics covered today. We will start with Amanda Mathie introducing the Occupational Health and Safety Management System, ISO 45001. Although not specific to health and well-being, this standard puts the employee as the central point within an organisation when covering all aspects of health and safety, and therefore would be amiss not to cover it in this webinar. Amanda Spedding will then provide a brief summary of how employee mental health impacts organisations and how COVID-19 has created some new challenges as employees and businesses begin the process of returning back to the workplace. Amanda will continue with an explanation of PAS 3002 and explain how the implementation of this code of practice can help support the physical and psychological health of an organisation's workforce. Following the end of the presentation, there will be an opportunity for you to ask questions. I will now hand over to Amanda. Thank you.
Thanks, Phil. As you can imagine, the focus on health and safety within the workplace has never been more prevalent than what we have seen over the last 3 months. And as we know, we expect to see this continue, with the HSE making this a key focus as businesses return to work. Central to all of this, though, has to be the employee. And this is where both ISO 45001 and PAS 3002 shares a common goal. The employee comes first. Now, the following slides are set out with some of the key points of ISO 45001. So, to start with, I'll give you a quick overview of the standard itself. Previously, a number of companies would have achieved OSAS 18001. These same companies are now going through or have already migrated to ISO 45001. This has become one of the more popular ISO standards in the industry, and this is set to continue as organisations look to demonstrate the health and safety compliance during this difficult period. It's based on the same plan, do, check, act approach as, for example, ISO 9001 and ISO 14001, and is also based on the Annex SL, which is common. One of the main differences is more emphasis has been placed on the commitment and participation. Getting all the levels of business involved, it's not just about dictating to staff what should be done, it's about getting their feedback and getting them involved. So why should companies consider working towards and implementing ISO 45001? The idea is to add a better framework to any existing processes and procedures that are in place, or alternatively even to introduce a framework into the business. It's heavily based around looking after your workforce, regardless of if they're in an office and just based there all the time, or even if they're on a site and that site might be classified as high risk. As I mentioned earlier, it's more about getting the involvement of employees into the process and consulting with them on how things can be improved. At the end of the day, they're the ones doing the job and completing the tasks. Potentially, they're the ones facing the risks on a day-to-day basis. The standard also focuses on knowing your legal requirements and ensuring that you fulfil them. You've also got the opportunity to put structured objectives in place. This will help you not only focus on areas of improvement, but also help you to reduce potential areas of risk, or even to fully mitigate them. So why should you consider implementing ISO 45001? This is usually a question I would ask any company considering the standard, or any company that I would be auditing against it. Why do you want it? Why do you need it? And to be honest, the answers tend to vary. Some companies choose a standard because it's driven by their customers. Unless they have the standard, they're not allowed to be a supplier, so it's straightforward, they need the standard. For others, it may be they work in a high-risk environment and have had high numbers of incidents and accidents of which they incur higher costs, for example insurance premiums or legal claims, and the bottom line is for them, they just want to reduce the cost. But in the main, the majority of companies who choose ISO 45001 is because they want to protect the workforce and those that are working with them. They want to do things right, they want to improve their systems. Ultimately, they're taking ownership. So how do you get started? Well, firstly, if you're not up to speed with the standard, get a copy of it. Once you've done that and you've had a read through, then ideally what you need to do is benchmark where you're at. So this can be done by carrying out a gap analysis. This standard shouldn't be implemented by just one person, so you need to get the buy-in from the key personnel within the business. You can then start to work on the gaps to ensure you are meeting the requirements of the standard, getting people trained, and then you can start to contact your certification body when you're ready to go for it. And with that, I'm now going to hand you back over to Phil.
Thanks, Amanda. That's a really helpful introduction to that very important standard. If you have any questions on ISO 45001, we will be more than happy to answer these at the end. Now I'd like to hand over to Amanda Spedding, who will cover the next two topics on mental health and PAS 3002. Thank you.
Thanks, Phil, and hello everyone. Mental health has been a subject which has historically carried some stigma, and still, to this day, unfortunately does. Here I'm going to talk a little about mental health effects and the impact it can have on your business. Mental health causes are wide and varied, from previous trauma, unemployment and poverty through to severe or long-term stress. Drawing on research, the Mental Health Foundation describes people with mental health problems as being the least likely group with a long-term health condition or disability to be able to find work, maintain long-term relationships, live in decent housing and feel social exclusion from mainstream society. This can all affect an individual's ability to function in their employment. Here are some statistics showing that a little over 45% of all working days lost are due to work-related stress, anxiety and depression, contributing to £15 billion annual cost to businesses and over £35 billion cost to our economy. Yet interestingly, only 36% of businesses have any form of support programme in place for their workforce. In 2018-2019, there were 0.6 million cases of work-related mental ill health reported, which, when we take into account any discrimination which may be felt by those who suffer, it's quite likely that this figure is somewhat more significant. So how can we go about addressing such an important topic within the workplace? Well, it starts with being able to identify when mental health issues arise. Thanks to charity and government campaigns, recognition of mental health issues are becoming less stigmatised and encouraging discussions and finding support. But judging by some of the statistics you saw on the previous slide, there's still a long way to go. As previously mentioned, mental health causes are wide and varied, and interestingly, work-related stress is one of the 3 top mental health conditions experienced by the population. Other less common but no less important conditions include post-traumatic stress, psychosis, bipolar disorder and trauma. People will often feel embarrassed or fearful of discussing any issues related to their mental health in case it results in any disadvantage to them. In a recent survey by the mental health charity Mind, a surprising 14% of people resigned and 21% of people had called in sick rather than discuss any mental health issues, which is a phenomenal figure. The effect this has on organisations results in more direct costs to organisations, such as an increase in sick pay, agency staff and not meeting delivery times for customer orders. This can have more indirect costs to an organisation too, which are not always immediately obvious, such as effects on the organisation's reputation and the potential effects on market share. Considering the pre-pandemic effects of mental health issues felt by organisations, the effects of the recent pandemic is a topic which should be explored further. COVID-19 has seen organisations move to working remotely and taking advantage of the government furlough schemes. Many organisations have already started to understand the effects of this on their workforce, and some employees are reporting an increased sense of isolation. Feelings of anxiety and stress have also been reported, with many employees nervous about returning to the workplace for fear of contracting the virus, the worry that they may have reduced work impacting them financially, and the unknown effects on what their day-to-day duties and processes might look like once the lockdown fully ceases. Additionally, the increase in stress reported from parents who've struggled to work and take care of their children at the same time ensure that they're occupied and that their education maintained should also be noted. In summary, mental health issues are a huge challenge for businesses, with effects felt in many different ways. The good news is that access to appropriate support is becoming more and more available to help tackle these issues and encourage a more positive culture around mental health. It's also great news that lots and lots can be done to support your employees, including counselling and support programmes, financial advice and guidance, the introduction of mental health first aiders, and development of your management teams to encourage conversations about mental health and to recognise any issues before they become a problem. Here I'm going to talk through PAS 3002, the Code of Practice for helping organisations support the health and wellbeing of their workforce. Here I'm going to talk about the purpose of PAS 3002 and how implementing this Code of Practice can assist your business, complement ISO 45001 and any other ISO standards you may already have in place, and help organisations in addressing some of the issues for employees which contribute to lost time, such as mental health, financial worries and work-related stress. So let's talk about the Code of Practice. As with the ISO standards, this Code of Practice won't guarantee that you'll be compliant with all of your legal obligations. Instead, what this Code of Practice will do is give you a great framework for supporting your workforce. The Code of Practice was developed by a large number of organisations to try and address an obvious gap in industry, It's due to be reviewed at intervals not exceeding 2 years and is designed to encompass people external to the current organisation, such as service users and retired employees. You can gain certification in PAS 3002, and there is a similar process in the Stage 1 and Stage 2 audit, and you would be subjected to recertification and surveillance audits in the same way as your 45001 certification. Some of the reasons for wanting to improve the wellbeing within an organisation include tackling mental health issues, as we've already discussed, but there are plenty of other reasons too. Organisations have been found to benefit in many different ways, including attracting and retaining talent, protection of value, improved customer service, and increased productivity. Generally speaking, people who are happiest often have the best performance in the workplace. A significant benefit of employing PAS 3002 can help to tackle a topic relevant to us all, regardless of sector, and that is the ageing population. In a report entitled The State of Ageing in 2019, Adding Life to Our Years, it is stated that without a fundamental change in employment culture and more opportunities for workers over the age of 50 to continue in work, individuals, businesses and the economy will suffer. Here's a brief overview of the synergies between ISO 45001 and PAS 3002. You'll see that there are distinct similarities in requirements for ensuring that policies established and communicated, leadership have defined responsibilities for conducting a management review and setting strategic objectives, and there are requirements for understanding the needs and expectations of interested parties. In order for us to be able to make significant progress and improve the health and wellbeing within our organisations, it's important that we have a deep understanding of where we're starting from. Establishing a baseline to monitor and measure our performance against is crucial in ensuring that we put the correct actions in place to address our most important issues and continually improve going forward. This all starts with understanding your workforce population demographics. Things such as shift patterns and hours of work might indicate that certain groups of people are more at risk than others, for example, night shift workers. Geographical locations can also present challenges in differing levels of access to healthcare, literacy and numeracy skills, and cultural practices. The age of your workforce may mean that there are additional needs not so significant in other age groups, and staff retention and available resource pools could contribute to the stress levels already present within the business. So what are the benefits of PAS 3002? Well, firstly, it's the right thing to do. It can reduce ill health and improve well-being and help to fulfil your moral duty as an employer. You can experience enhanced business performance with sickness being reduced, boosting productivity and profitability. It can create a better place to work, which makes it more attractive, helping recruit and retain talent. It can help support your legal responsibility to protect your workforce from harm. It can also help management make better evidence-based decisions. It also strengthens your ISO 45001 certification. It's an excellent fit with 45001 Occupational Health and Safety Management, combining to create a comprehensive health, safety and wellbeing system which can be audited together. There are 5 key principles which underpin improvement in health and wellbeing, and these are diversity and inclusion. Equality is being invited into the room. Diversity is getting a seat at the table, with inclusion being able to share your views and have your views heard. For those of you already familiar with ISO 45001, there is a great complement here to the consultation and participation of workers clause in 5.4. Proactive support, in providing proactive assistance, support and guidance for your workforce for both physical and psychological issues. It can really start to mitigate any risks before they develop into more serious issues. Examples of this might include items you're already familiar with, such as risk assessments, health and safety committees and training. But it could also include defined career development pathways, exercise and social groups, and work-life balance policies. Work culture. So promoting and achieving a positive work culture can be a difficult task, but there are ways in which this can be encouraged, including corporate social responsibility and ethical initiatives, encourage cross-working and collaboration opportunities, and as the work report of April 2019 suggests, leaders and managers are important role models in fostering healthy behaviours at work, so recognising and developing management styles can have quite an impact. Job and work design can be the costliest methods for improving health and wellbeing throughout an organisation. However, evidence shows that far greater impacts on performance can be achieved. Changing the ways we work in flexible working, how we interact and collaborate, and how we use systems can create less monotony, reduce frustrations, and increase productivity. Good policy and practice framework provides greater structure, control, consistency, and fairness within an organisation too. So the structure of PAS 3002 is a very similar framework to the ISO standards, including the Plan, Do, Check, Act cycle and a process approach within clauses 1 to 10. The clauses start with health and wellbeing, context, strategy and policy, leadership, establishing health and wellbeing of workers, the monitoring of health and wellbeing, analysis of health and wellbeing information, reporting and reviewing health and wellbeing performance. It should be noted that there are a number of areas within the Code of Practice which state the organisation should retain documented information as evidence. There are some terms and definitions which will seem familiar and some which may not. Effectiveness, objectives and organisation are outlined in other ISO standards, but PAS 3002 defines health as state of physical, mental and social well-being, not merely the absence of disease or infirmity, and health performance as a measurable result of the health status of the workforce in an organisation as a whole. Again, some of these terms which should seem relatively familiar with outsourced processes or function, process, performance and policy being commonly used across other ISO standards. These terms are somewhat more specific to PAS 3002, with a standard describing what the meaning of target population, a specific group of people where particular interventions can improve their health and well-being, well-being itself being described as comfort, happiness and healthiness and being a subjective term, and workforce health data being described as a quantitative measure of the health status of an organisation. Clause 3 then draws on these 5 key principles, ensuring that diversity and inclusion as an organisational strength, providing support to help people help themselves, encourage a positive experience in improving the culture of the workplace, reviewing job and work design to allow people to play to their strengths, maximise opportunities and create a degree of flexibility, and ensuring that appropriate organisational policies in place to ensure a fair and structured approach. Clause 4 goes into the context of the organisation, or the situation in how the organisation operates. This should include needs and expectations of workers and interested parties, risks and opportunities analysed and evaluated, and establishing a strategy for improving the health and wellbeing of the organisation. Tools such as SWOT and PESTLE analyses, which may have been used to explore this subject further for your ISO 45001 management system, for example, could be utilised here, and this clause should be regarded as an information gathering exercise, providing an indication of what is most important to the organisation and its workforce, and devising ideas about what actions could be put into place to benefit everyone. Clause 5, leadership, is pivotal to making any management system work. Clearly defined roles and responsibilities of those in management positions are noted here and requires similar actions to be taken by top management as with other ISO Annex SL standards. It also includes the role of HR, line management and workers themselves too. Clause 6 is about determining what actions are appropriate and need to be put into place, followed up with how and when they might be employed, again similar to 6.2 of ISO 45001. In this clause, it's expected that those target populations identified as having low levels of well-being and/or health will be prioritised in an effort to address and reduce any inequalities identified. Clause 7 is all about monitoring how well we're doing and measuring the benefits and increased health and well-being within the organisation. Attention should be drawn to the handling of data obtained, as it may well contain some personal and sensitive information, so appropriate systems for obtaining relevant data, consent and managing the data thereafter should also be in place. Clause 8 is where trend analysis comes to the fore. It's great to be obtaining and compiling data on the status of health and well-being of the workforce, but we need to use this information to help guide us through future steps. Evaluation of how well the action plan has been implemented to improve health and well-being should be assessed against the criteria set out in earlier clauses of the Code of Practice. This clause encourages promotion and documented results of the health and well-being efforts employed by the organisation. This clause recommends that these results are documented and published in relevant organisational reports, including the annual report, and then disseminated throughout the organisation. This clause is calling upon top management to review the health and wellbeing performance against the strategy set in earlier clauses. Participation of interested parties is recommended where appropriate, and results should be used to derive opportunities for improvement and include any further actions to address any changes which may be necessary. So in summary, we've discussed the 5 key principles underpinning the efforts of the Code of Practice to address work-related health and wellbeing issues. We've discussed the structure of PAS 3002 and how it's designed to help meet the needs of workers, and how the Code of Practice can complement the requirements under ISO 45001 and other ISO standards. Thank you very much, and I'm going to hand you back to Phil now.
Thanks, Amanda. That's a great explanation of how PAS 3002 can bring a structure to an organisation that helps proactively support their employees during this difficult period. At Alcumus, we have produced a variety of resources to help get businesses started with PAS 3002, such as a free gap analysis and bite-sized training. You can access these both on our website and also on our free-to-access COVID-19 platform. This platform is helping hundreds of businesses navigate the various challenges presented by COVID-19. As well as access to a variety of gap analysis and bite-sized courses, users are able to access a set of pre-configured applications, including a variety of risk assessments, such as the return to work risk assessment. It also includes DSE assessments for home workers, cost assessments, a furlough tracker, which includes a salary calculator, as well as the ability to track assets that have been provided to remote working employees, for example, laptops and chairs. Like I say, this is free to use, so if you need any further information on this, please do not hesitate to contact myself or visit our website. I would like to thank you all for listening. We're now available to answer any of your questions. Thank you.
Many thanks, Phil, Amanda and Amanda. We've received quite a number of questions, so apologies if we do not get through all of them. But should we run out of time, we will review the questions remaining and provide a response where possible. So I think to start with, I'll have to ask the one question that I've heard on a number of occasions. Do you know where to get a copy of the standard without paying through the nose for it?
The normal channels would apply to get the standard. As far as I'm aware, there aren't any free copies available at the moment. Anybody who's working with a business and might have a consultant with them that could go through it, but unfortunately there aren't any cheaper copies available, so the normal routes would apply.
That's what I did expect, actually. So, does the PAS standard generally have the same legal status as HSE ACOPs, given they are classed as a code of practice?
With regards to the PAS, like you said, with it being a code of practice, it doesn't mitigate any legal requirements. So although it doesn't have the stance of an ISO, there are still legal requirements and you still need to go with those. So as I said, it doesn't mitigate anything at the moment.
One that probably leads on from that, do you know if there are any plans with regard to this becoming an international standard?
At the moment, there aren't any plans. However, it has been set out within the code of practice that it will be able to transfer across to being an ISO standard later on. That's why we've been following the Annex SL process, which is the same as, well, it crosses over from 45001 that has the Annex SL. So it does have some duplication. So should it then become an ISO, it should be able to fall in nicely with other ISO standards, but at the moment there aren't any plans.
And is there, sort of linked into that then, is there any way for it to be audited in any way? So if a company does decide to introduce PAS 3002, is there anything like at the moment with 45, with 9, you effectively can have that certificate you can put in your tenders, show to customers, etc. Is there anything that somebody can demonstrate that they meet the requirements of this code of practice that can then be demonstrated to other people?
It's exactly the same process. Although it's not an ISO standard at the moment, we have decided as a business to follow the normal ISO processes. So a company could sign up to doing a pre-assessment. So if, for example, I know one of the questions that came up on the Q&A was, when do you know when to go for the standard, whether it be ISO 45001 or PAS? Then the first step is having a look at the standard. You can do a pre-assessment. If you don't want to do that, then do a gap analysis, have a look at where you're at, look at where you need to be, and then the normal process would be the same as an ISO standard. Stage 1, stage 2, your surveillance, and then obviously years to follow would be your recertifications. And at the end of that, it's the same as an ISO. You would get a certificate to show that you have been audited against that code of practice.
So really then making sure doing that gap analysis in advance really helps. I know somebody asked the question of when you should move from HSG 65, if that's the method you followed, is by doing that gap analysis, at least you'll know where you're up to.
Exactly. What you don't want to do is say, right, we're going to go for it, and then find that you're way off the mark. Regardless of whether you've got ISO 45001, we have got interest and we have got clients that have gone for the code of practice without the other standards, without an ISO. But again, it's benchmarking where you're at. Seeing a lot of companies will have a lot of things in place, but it's a case of formalising it. So a benchmark or a gap analysis is a good starting point.
So one question that's come from regards to service users. So what is actually meant by a service user?
I'm happy to take that. So service user, it's really sort of contextual to the business. Service users could potentially be those maybe what would have been known as in the past sort of residents, maybe in care homes, that kind of thing, potentially prisons and inmates from that point of view. It could also be a service as in perhaps maybe more of a service, like perhaps a software type service. They would all be service users and also be customers.
Okay, so somebody's asked, with the 45001 standard and then having also this code of practice, because they're so closely related, is there any sort of argument to say that they should actually maybe be joined? Or do you think maybe going forward 45 may encompass a lot more of the items highlighted in the code of practice?
A lot of the standards that we audit against, you will see some duplication from one standard to another. I think this adds a little bit more of enhancement into the wellbeing side of things from the 45001. Again, until PAS 3002 goes across to be an ISO, we wouldn't know where those crossovers are. It's more like an enhancement to 45 if you've already got it. However, like I said, we've got customers that are going for it as a standalone code of practice as well.
So I've been asked, can you give a practical example of inclusion? People said sometimes, maybe become a challenge to get the workforce engaged in the consultation process. Any sort of hints or tips with regards to how that can actually be done? Because I know for yourselves within Alcumus, it is something that you've also implemented.
Go on, I'll answer that one. With regards to inclusion, there's many different ways. 45 covers with regards to participation and commitment. You might want to set up small groups within your business, so you might have wellbeing representatives in your offices. If you've got multiple offices and multiple sites, bringing them together, or you might have 1 or 2 or 3 people within an office at a time that could be wellbeing champions. We've got different ways where those individuals might also want to be trained as mental awareness first aiders. It's also, the hardest part is getting people to talk. That we know is a challenge, and that's where obviously Amanda's mentioned within PAS 3002. You might want to do surveys anonymously to start with. It's getting things out there. We have recently had a wellbeing awareness week, so it's having that promotion within your business, making it that it is something that you can talk about openly and freely. And they're just a couple of points of things that we've tried within Alcumus and work really well. We've also included people that work in the field, so it's making that inclusive, not just to the office environment, but making sure that people don't feel even more remote by saying, oh, well, that goes on in the office, what about us? So it's including them in participation as well and getting their buy-in. We had things like, we did a week of exercise so people could get involved where necessary and where they were fit and able to, and different challenges, which went down really well.
So a question with regards to sort of somebody that's already like a lead auditor for 45, for 9, for 14, will there be any opportunity for a sort of a lead auditor's course for this particular code of practice?
Certainly. At the moment, we do offer a PAS 3002 training course. It's 1 day, but obviously as this sort of gains a little bit more momentum, certainly if there is interest, that is the plan going forward. Yeah.
So what one question with regards to the uptake of this code of practice, are you seeing an increased uptake? People are very aware of this code of practice, and how many people are therefore adding it to maybe their 45001 management system they already have?
Initially, going back a couple of months before lockdown and before the sort of whole COVID-19 issue that's arisen, we had a steady stream of interest into the code of practice on its own. Now, during the lockdown period and obviously working remotely, that is increasing. And as I say, a lot of people are saying they want to do it as a standalone. I think time will tell. Now is probably a good time to start looking at even more, because you have got people that are isolated and working from home. So although the companies are still working, businesses are still running, and companies are making money, at the end of the day, if you've got somebody who's working from home, and they might be throwing themselves more into work than what they should be doing and not taking that time out. So I think now is a good time to start looking at your staff, looking at your employees, see how they are coping. Now, whether you implement it now or work towards implementing it when they're going back to work, that's obviously something that companies will have to make a judgment call. But yeah, the inquiries are increasing.
So looking at from the standard, When you look at the definition of a worker within the ISO standard, would that mean when you're actually looking at monitoring recording information, would that also involve contractors that you're working with?
Yeah, absolutely. Sorry, I thought the other Amanda was going to pick that question up, sorry. But yeah, no, absolutely. Subcontractors, agency staff, temporary staff, all of these different sorts of people need to come underneath, just in the same way as it would with 45,001.
And we've had a few requests for examples of sort of either risk assessments or documentation associated with this, a gap analysis. What is listening to them? Is there anything that they tap into to actually get examples of these documents?
Sorry, you broke up a little bit there, Jo, but yeah, with regards to the gap analysis, there is a gap analysis available for PAS 3002, and it's broken down into each section. So it'll give you a guidance of what is the requirement, and then it gives you the opportunity to look at where you're at and what you need to do. So you can put it from a point of view of what you have in place with regards to the framework, and then what work is still required, and it goes through the whole code of practice and allows you to assess where you're at. That can be accessed through the link that was provided on the slides.
So we have a question with regards to how do you accurately measure workplace mental health, against what criteria, how can you prove its precision?
When you're talking about precision, it's precision against what? At the moment, when you're benchmarking it, you're looking at your own internal environment to start with. So it's a case of, until you know where you're at, you can't move forward. So a lot of it within the code of practice is gathering that information up to start with. So it's looking at absence, looking at sickness, how long were people off work for, what was the reason they were off work for, what is the time frame that they're on leave. It might be a week. Is it regular that taking 1 day, 2 days, 3 days? Is it that somebody comes back off long-term sick and then goes off again? It's establishing that information first of all, before you can then start to say, right, that's where we're at the moment. What do we want it to be as a business? Do we want to reduce it? Hopefully yes. And then how can we reduce it? So you're kind of benchmarking yourself against your own figures. It's all right looking at other businesses, but that depends on what they do. They're not necessarily going to be apples for apples. So it's a case of gather the information in your own business to start with, look at what you want to do to achieve that, and then obviously go back to what is the root cause that causes that person to be off in the first place. That's a key element of PAS 3002.
I think just drawing on the back of that as well, some around the context of the organisation. This is where understanding that workforce around the demographics, the types of people, the locations, you know, there are industries which, you know, are a bit biased towards one gender or another. So there's things like that to really sort of consider as well, which can all start to sort of frame where that mental status might be to start with, and then drawing on that, monitoring those sorts of things that Amanda's mentioned there.
One thing I've been asked to sort of reiterate in relation to mental health and wellbeing, that people on the autistic spectrum come under this topic as a mental health disability, and that, you know, words can be very damaging and have a far more lasting impact than a physical attack on a person. And as Karen says, think of the impact your words can have on yourself if you were at the receiving end of such utterance, and treat people as you would if you want to be treated yourself. I think sometimes there is that whole, people also don't want to speak, inform anybody. So again, with that engagement side of things, if the company is reporting but people aren't actually informing anybody, speaking out, discussing, how can the information you're actually reporting on, again, it comes down to that accuracy of how much detail do you have to put in there.
I think one of the main things, and I think from somebody who's just made a comment with regards to HR as well, the first line of contact is not always going to be occupational health. It's not always going to be HR. Potentially, it's going to be line managers. Line managers know the team. They work with the teams on a regular basis. They're the ones that are going to potentially spot any issues. So it's not necessarily about people communicating it directly and saying, I've got a problem. It could be about behaviour. It could be, as a line manager, spotting somebody's changing mannerisms, somebody who's quite chatty all of a sudden becoming quite tired and quite quiet. It could be somebody that's alternatively that just wants to spill the beans. Not everybody wants to sit back on a couch and talk to a therapist, but it's the difference between having somebody, when you ask them, how are you? And it's the words, I'm fine. Now, does the words I'm fine mean they're okay, or is it just an easy way of saying, I don't want to talk about it? So I think a lot of it is getting people to listen, as well as getting people to talk about it. It is very difficult to get people engaged if they don't want to talk. But I think in the first instance, line managers are always a good point of contact.
So we have a question going back to sort of the certification side. Is there, if there will be any plans with regards to the likes of UCAS to offer an accredited certification rather than just companies offering unaccredited certification?
As is the case with a lot of codes of practice, if there is enough uptake within the industry, then that is something that we can approach UCAS for. I am aware of other codes of practice, not just in this arena, that have been done as a standalone accredited certification. At the moment, there aren't any plans, but it's not to say it won't happen.
And how many people at the moment, you probably can only speak from Alcumus' side, approximately sort of companies that have taken up this particular code of practice?
I would say we're probably coming up to about half a dozen at the moment that are going through the process early doors. We've got obviously a number of inquiries, but it's getting it up and running, doing the remote audits. Some people are comfortable with that. A lot of people are really happy doing it remotely. Other people do prefer the hands-on approach. So the numbers are increases, and you know, we're at sort of stage 2s in surveillance, first surveillance situation at the moment.
I think as well it's important to understand this is a relatively new and unknown code of practice at the moment. So I think you know, as Amanda says, as the uptake increases, there will be more moving forward to become an accreditor. I think you know, webinars like this where we're trying to raise awareness of the importance of this standard now to help provide structure for businesses going forward.
There's quite a few comments coming in with regards to from smaller businesses, because they don't have the same infrastructure as some larger organisations to have internal in-house sort of support. You know, and again, moving sometimes those smaller businesses to adopt new processes like 45. Again, with, you know, the wellbeing, are there any other areas of support maybe small businesses where they could go to assist, other than organisations like yourself, but maybe Mind or anywhere else they can be signposted to help support, to get them to implement these sort of codes of practice?
Absolutely, there's so many out there. As you quite rightly mentioned, Mind is a great place. CIPD has loads and loads of resources around ideas around how you might be able to adopt this or at least make improvements. There is quite a lot of references in the back of the code of practice as well, around different work reports, different websites, different free resources available, and some great case studies as well in there, which are definitely worth a look as well.
Can we have one comment with regards to, you know, one of the challenges of dealing with COVID-19 is the fear of stigmatisation. And it's been commented that as a result of their workplace, they've seen a drastic reduction in hospital visits. What is there any advice you can give with the best way of dealing with stigma and fear?
I think certainly for me, as with all the standards, a lot of this is driven through leadership, and there's different levels of leadership throughout every business, small or large. And one of the reasons why leadership was brought into the Annex SL structure as a standalone topic in itself. And I think certainly, you know, I have a lot of different clients, a lot of different industries, and you know, they've all approached it in very different ways, but it's about sort of bridging the gap. I think that's been possibly the most effective around sort of dealing with any sort of stigma or any sort of fear or reprisals. I mean, that is also something else that's covered in 45,001 as well. So leadership is very much a pivotal role, I believe, certainly. But then sort of adopting those 5 key principles and trying to really sort of play to people's strengths and those human behaviours, those human factors, can be a really, really encouraging point as well.
So when going to the actual sort of looking at 45,000 and PAS 3002, can you give an example of an interested party that may be included or may be different from the 45 versus the code of practice?
I think this is one of the areas where there is quite a few similarities. Trying to pick one that would be different probably would be hard to do. I'm trying to think of the companies that I've audited to date. One I was thinking of was potentially neighbours to a particular environment where that's been worked, and how, without going into detail of who the customer is, but what they actually did was invite their neighbours into the business to come and see what that environment was like, what they were doing, what would happen if there was an issue internally, and how that could potentially impact them, putting their minds at rest. They had regular updates with them. They had Q&As, newsletters. So I think trying to find something that would be different from an interested party, there are a lot of similarities more than differences.
So for those then that have not actually gone down the road of maybe 45, so we're considering sort of your interested parties being the actual employees, the contractors, suppliers, etc. Because I think sometimes people get a bit confused of what is an interested party, and tend to just think of it being internally and maybe don't look at that external as service providers and things like that.
Yeah, it's definitely external as well. If you're looking at environment, it could be suppliers, people that are visiting. It could be regulatory bodies that have an involvement in what is actually being done within the business. So yeah, it's definitely internal and external to be considered.
Probably one little maybe explanation, people, is how do you determine what is the context then of your business? What should you maybe look at to get that defined correctly?
I was just waiting to see if Amanda Mathie was going to go on that one. In context, it's anything and everything that impacts your business or you impact. So it talks around things like internal and external issues, which again will be very specific to individual businesses, even if they're in the same sector. Interested parties will be, as we've already said, there's probably more likeness than there is difference, but there may be the odd ones. We might be talking around things like special interest groups or kind of forums like that you might be involved in. They might be interested parties. But then, as I mentioned before, looking at the demographics of your workforce, that's the biggest key. There are some quite striking differences with different locations within the same county, for example. You know, Leeds, I think the last time I checked the figures, I think 60% of the Leeds population were over the age of 50. And obviously, towards the second half of your life, that's where perhaps different issues may arise, as you know, in complete contrast then to perhaps if 60% were below the age of 21, for example. So it's those sorts of places to start looking at things like, if we're working internationally, literacy, numeracy skills, level of education, access to healthcare, all sorts of things like that will go into it. Does that help?
Yeah, that certainly does. And also one person's highlighted the fact that, you know, one interested party is actually the family members of employees, especially when we're looking at well-being, is that they themselves can be impacted on what's happening. So that, you know, to always can maybe consider those as an interested party. I don't know what your viewpoint is on that.
I think definitely that is an area to consider. It's quite surprising sometimes with companies that don't realise how many individuals who work with them are actually carers or primary carers at home. So they're holding down two jobs, a carer at home and the work, and potentially that can have a huge impact on an individual, which then has a knock-on effect to their colleagues and the work.
And one question with regards to the actual process of introducing this actual code of practice. Are internal audits required to be carried out as part of this, like they would be for 45, for 9, for 14?
Yeah, internal audits, you still will need to do those. And again, it's another way of benchmarking and checking. We always encourage people to do an internal audit prior to having an auditor come and do an audit, or in this case, a remote audit, because what it does, it helps you capture anywhere that there might have been issues or things that need to be adapted or changed or improved. So yeah, internal audits would be required.
Excellent. Well, unfortunately, we're starting to run out of time now for questions. But what we will say is, with regards to any questions that we do have, is that we will review those, and if we haven't answered them within the actual presentation itself or within this sort of quick Q&A session here now, we will actually get any answers to people. So from the consultancy group, from myself, I'd like to say many thanks to Phil, Amanda for your time today, and also to everyone on this webinar for attending and for all the questions you've posed. I think it's been very informative, certainly from my personal point of view. I've posted in the consultancy group email address into the chat box, so should anybody actually have any other questions, please direct them to me and we'll get those answered. I'd also like to thank Ben, who was busily working behind the scenes to make this webinar happen, both pre-webinar, during webinar, etc. So many thanks to him. So please keep up to date with the consultancy group and what we're doing. So follow us on LinkedIn, Twitter, and we also have our own webpage on the IOSH website. And links can be found on our recent mailers as well. And there's a huge amount of events that IOSH are doing at the moment. So please visit the events pages and you can keep up to date with those. One final thing, IOSH Council nominations are now in, so please look out for the elections. If you are eligible to do so, I urge you to use your vote. Please use it. It is too late once the voting is closed, so please look out for those elections. And it only leaves me to say thank you for attending, keep safe, and see you soon on another webinar. Thanks.